Good afternoon and welcome to All About Animals. I'm Sherry Graditor. Today we are at the Veterinary Specialty Center in Buffalo Grove, Illinois. And our guest today is Jeanette Potter, you run the rehab
center, yes.
Rehab center here. And we want to talk a little bit about the aging dog. November being the month of the senior dog. What kinds of things do we run into? What's involved with keeping our senior dog healthy? Okay, Jeanette, you're on.
Everybody wants to keep their dog that's 14 to again, and we try to do the best that we can. You want to make sure that they stay thin because as they get older, their joints get worse. They wind up with arthritis. You want to make sure their teeth stay clean because that runs into bacterial infections in the rest of the body. You want to keep them moving is one of the biggest things that I can tell anybody to do, and don't do the weekend warrior syndrome. Everybody always wants to, I have Friday, Saturday, and Sunday to play with my dog, and let's do 3 miles when the dog's been laying on the couch all week. So that tends to be the biggest problem I see happening, is everybody wants to make that 14-year-old dog 2 again, and you can't do that in one weekend.
Okay, you can't do that at all, but what can you do?
I am a big advocate of keeping their weight down, making sure that they have the hourglass figure from up top, so they should have a nice curve, and then underneath their chest should be like convex, and then their abdomen should be up here. Most of them wind up being a balloon up top and a balloon down below, and there's no distinct body type whatsoever.
You just described my figure.
So what happens with that adds extra weight on all their joints, their knees, their hips, which then in turn becomes a lot harder for them to carry around. It's just like us. We gain 5 pounds. You feel it in your knees. You feel it in your back. And for them, it's not an easy task for them to carry it around.
And 5 pounds for a dog that weighs 60 pounds is a heck of a lot worse.
Yes.
Than 5 pounds for a person who weighs 120. Please God, that was me. Yeah, it's just, it is a burden on them.
It is. And
there are ways to control that.
Yes, diet and exercise. Just because the bag of food says feed your dog 6 cups because it weighs 60 pounds doesn't mean that that's necessarily the right type of food, the right quantity of food. I'm a big advocate, instead of doing a treat every time they come in, grab the fresh fruits and vegetables, carrot sticks, celery sticks, apples, bananas. No raisins, no grapes. It causes kidney failure. They tell you to stay away from garlic and onion because of irregularities in their blood. But it's one of these that instead of going to that cookie jar, we can go to our little drawer in the refrigerator and grab them some carrot sticks and celery sticks, and it usually works pretty well. You want to start them out nice and slow and easy because you got to make sure that their digestive tract handles it. Some of the dogs, their stomachs don't tolerate it, but if they do, green beans works fantastic too.
And frozen green beans are a big treat.
They're amazing. Yeah.
Big treat. Okay.
Ice cubes too.
Yeah. No calories. So, okay, we have a dog that is in relatively good physical condition, not terribly overweight, but the dog is limping. And we investigate and we're dealing with something like an age-related arthritis.
Mm-hmm. Which most of us are.
Yes, indeed. So you do offer treatment.
Yes.
Here.
There's multiple things that you can do. As I had stated before, just typical walks sometimes will work. Just do them nice and slow and controlled. Pay attention when the dog gets sore, and sometimes just getting their joint fluids up and moving. There's glucosamines, there's fish oils, there's supplements that you can get from your regular vet, some of the holistic vets. There are even some of the more natural pet stores that are out there now that are feeding better quality foods. There's a lot of people out there that like to do the raw food. They think that that's better. A lot of the times if you just do a higher protein, low carb diet, because it feeds cancers and it feeds arthritis, they tell you to stay away from peanut butter and stuff like that. There's little tricks to the trade where you can kind of just mess around with the diet sometimes in itself, and that'll work. If you find that that's not working, then we have other modalities. We have underwater treadmill, there's free swimming pools. There's injections of Adequan. We now are offering stem cell treatments. We have
Wow.
shockwave, we have laser treatments, we have acupuncture. It's endless possibilities.
And it's all the stuff that we've been doing for people for a
Yes,
long time.
that's where most of it started.
And now it's percolating down to where you can get this help for your animals. Why swimming and why treadmill?
I love it. I think it's fantastic because of the fact of the buoyancy. So what happens is the general first swim will start up at their greater trochanter, which is their hip bone, makes them 60-80% buoyant. So now they no longer have to support that weight that they would on land. So now what happens is they can actually utilize muscles that they haven't used, because if they support all their weight, their hips hurt, they throw all their weight forward, their shoulders, all this hurts to begin with. Now you're throwing even more because they're trying to off weight all the weight from their back end to their front end. So what happens is in the water, you kind of make it at all an even playing field, so they can start building up the muscle with the resistance of the water. And it makes it fun for the dogs, and it makes it kind of an activity for the parents to bring them in, and everybody has fun doing it.
And free swim also, same thing?
It depends on the situation. With elbows and shoulders, I tend to like to free swim more. When it's back end stuff, I like to do the underwater treadmill more. I know there's a lot of free swimming pools out there, and everything kind of has a time and a place. I'm a big advocate of front end for the free swimming pool and back end for the underwater treadmills.
Interesting. But both of those will build an animal up, and that
Yes,
really can
it
offset.
helps. Well, it helps endurance. It takes the weight off of them. You get your heart rate up. You get, your respiratory rate up, and it overall conditions the body.
Okay, now I know about adequate injections because I had a geriatric dog
Yep.
who got adequate injections for a long time.
Fantastic. I've used it for 22 years.
It's wonderful. And adequate is, explain it because I can't.
The easiest, simplest way to explain it is it's like a liquid glucosamine that you do inject the injection. So what happens is there's controversy over whether to give it sub-Q or IM. The label is
Sub-Q is under the skin, IM is intramuscular.
Yes. The label is done IM for the intramuscular. My previous doctors that had worked with me had talked to the manufacturers, and they allow it to be given sub-Q. I get quite a few phone calls. You're doing it the wrong way. And I'm like, no, we've actually checked it out with the manufacturer, and they're okay with it. And there's different protocols that are out there. The typical protocol that we use here is you do one injection twice a week for a month, then one injection once a week for a month, and one injection once a month for life after that. And you keep them on it until they're over geriatric, and then you kind of bump it back up. But what happens is it goes into the joint. It provides an extra joint fluid, so they're no longer rubbing bone on bone.
It makes the joint slippery.
Yes,
Yes. And when the joint is slippery, it doesn't hurt.
exactly.
Yes, it kind of slides.
Exactly.
It is not inexpensive.
It's getting cheaper as it's been out a little bit longer.
Okay.
The bigger the dog, the bigger the expense is. If you have a smaller dog, it'll last you a lifetime. If you have a bigger dog, you're going through a bottle a week.
And so wherever it is, but I know that you get results from it because I've been there. And it really did help my old girl when she was getting them. Then I was told about something you're doing here with sound waves.
It's called Shockwave. They've changed the name to acoustic therapy because of the fact that it doesn't sound as traumatic as a shockwave. So what happens with that, it's a force of energy that goes into the joint that is providing, it kind of numbs the pain around the joint. So for the dogs that have cruciate ligaments, for the dogs with hip dysplasia, for the dogs with, like, it would be like if you had plantar fasciitis on your foot, you go in there and you kind of dull the nerve endings to help control the pain, is the easiest way to describe it for us. I've had fantastic results. That's my newest toy, is I can put it. Back in the day, we had read about it in books. I had always wanted it, but I didn't think physical therapy was something that I had to sedate a patient for. We now have, I think, one of the only, or one in the Chicagoland area that doesn't require sedation for. So that's been the new addition to this because I didn't want to sedate a patient to do physical therapy to it.
Now let me ask you a question about that. Is it painful to the dog? Or say no
There's
sedation?
a little discomfort. Like if you put your finger to it, there's a little discomfort, but as it continues to go, it like numbs that area, so it's not uncomfortable. I haven't had any dogs react where they try to turn around and bite or any of that other stuff. It's been a very, so far, pleasant experience.
And how long does it last?
They tell me 4 to 7 days. We can do the treatment every 4 days. If the dogs are super, super uncomfortable, it can last up to a week. And they tell you the treatments can go anywhere from 4 to 10 treatments to get a long-term effect, and then kind of do it as needed afterwards.
And but it does build to a long-term
Yes.
effect.
Yes.
So basically you're not doing it every 4 days for the rest of the animal's life.
That's the theory behind it.
That's what we hope for.
Yes.
That's what we hope for. And, we're going to kind of gloss over acupuncture. We know that it's there. We know that it works.
Yes.
And the reason we know that it works is the dogs that get acupuncture respond to it. And nobody has told the dog, hey, if we
there's a
put this little
placebo.
needle here and turn it around, you're going to feel better. Nobody can tell the dog that, but the dog gets better.
Yep.
Consequently, it has to be the acupuncture that works. So you're talking about Oriental medicine. You're talking about new wave medication or treatment, which is your sound wave. You're talking about water, which has always been good for a dog,
Yes.
but now you're doing it in ways that are controlled.
Right, and we do water aerobics to make us feel better, and you know
Yes.
how that goes.
Yes. So there are things that can be done. And should I ask you to go through them real quick, or should I? How's your throat?
I can go.
Okay. So we talk about body weight.
Yes.
What else? Mouth.
Mouth.
Go for it.
If you don't keep their weight down, it's just like us. You wind up with diabetes. You wind up with heart disease. You want to make sure that their teeth stay clean. Brush them as often as you can. Bones to chip off any of the tartar. You want to make sure that you keep them active. You don't want them being couch potatoes all the time. Make sure that their nails get trimmed, because the poor dogs, when they're old and they're walking on top of their nails, they're not walking on their foot. They slide around the house. If you have hardwood and linoleum floors, throw down little rugs. It helps them get their grip and they're not slipping all over the place.
Or put little socks on them.
Socks, yes.
With things on the bottoms.
Yes.
We have those. Jeanette, I'm going to stop you because we're out of time. Can people call you
Yes.
and ask you?
Yes.
Where do they reach you and how?
It's at our hospital. My department's Therapet. It's 847-459-7535. At the moment, it's extension 2253 because our phone keeps going up, but they can also press 0 and ask for the operator.
Or they can ask for you.
Or they can ask for me.
That's Jeanette Potter. And I mean, if you've got questions, and people do.
Yes.
Give
Happy
them
to
a call.
help.
The stuff is wonderful. We are now going to take you to Save a Pet and show you some of the dogs and cats available there for adoption.